cough. And the pathogen is Bordetella pertussis. And it's a small aerobic gram-negative coccobacillus. Virulent strains, meaning those that can cause the disease, have a capsule, and they also produce several toxins. It's showing you your lower respiratory tract. So it starts out with bronchus, going down to smaller and smaller things, bronchioles, and you end up with those little alveoli, which are little air sacs where the actual gas exchange is taking place in the lungs. Back to pertussis. The bacteria attach to the ciliated cells in the trachea, and those ciliated cells are there to move mucus and things out of your, where it doesn't belong, up into your throat where you can swallow it and it doesn't cause any problems. But these bacteria attach to those little cilia, and your book has a really good picture in it to look at. And it causes them not to be able to move that mucus along then. It prevents what they call the ciliary escalator. And it actually can destroy those cells, the ciliated cells. So the disease, whooping cough, progresses in stages. The first stage is the catarrhal stage. That's where you have symptoms where it seems like you have a cold. Second stage is the paroxysmal stage. That's when you have these prolonged series of coughing. So you're coughing, you're trying to get that mucus up, but your ciliary escalator isn't working well. And you get these violent coughing spells. And they're so strong that they can actually break ribs in small children. And pregnant women too, I imagine. You should get on the internet. There is a site where you can actually hear this sound of this whoop in the whooping cough and listen to it. It's quite interesting. So in between these coughing spells, then the patient is gasping for air, and that's what produces that whooping sound. And so you go through, it's a pretty long disease when you have it. So that stage lasts anywhere from 1 to 6 weeks. And then you have the convalescent stage, and you just have a sporadic cough, and it slowly goes away. And that stage, it can also last for months. And here in California, we have epidemics of whooping cough. Most years, you'll hear about it. The vaccine for whooping cough is that DTaP, the AP standing for acellular vaccine. So now it contains an assortment of the bacteria's virulence factors instead of the bacteria. Like in the 1940s, the vaccine was a whole cell vaccine where they killed the bacteria. Now they're only taking like the antigen parts of the bacteria, which might be a part of a capsule or something like that. The vaccination starts to wane, and you need another booster shot in 12 years. So the problem is that I think that they're thinking, yes?
Is there a difference between DTaP and Tdap? Because like on the immunization records where I work, it lists both of them.
Which one? Say it.
Tdap and DTaP. And it says, yeah.
And D.
Yeah.
This one? I don't know then what the difference.
But it lists them both as pertussis and diphtheria.
I don't know the difference between them.
Tdap is every 2 years you get a booster shot.
What is it?
She said every 10 years you get a booster shot for the Tdap.
Rather than the other one, yeah. And if you go into, if you cut yourself and go into the hospital, and you know how when you got a wound the last year if you've had a tetanus shot? Now that when they give that tetanus shot, it also has this diphtheria mixed in with it. And, you know, the big concern is most of these vaccines that you get as a child, they need booster shots, and they're saying that we're gonna get adults that that you get we're gonna come out with all these adults that are gonna be susceptible to all these diseases. Okay, so let me we'll stop here, and somebody remember that we stopped at tuberculosis, and we'll take up with that next time. To the lab work, Tuesday's lab, I have both labs. When you do your lab practicum, it is in two sections. You will either be doing it at 8 o'clock or at 8:30. Those are your choices. So I will have a sign-out sheet. Thursday, you can be thinking about it, because when you come back, then you'll sign out for it. Tuesday, you're gonna sign out for it this Tuesday. Yeah. So choices 8 or 8:30. And just to tell you a little bit about the lab practicum, there's 20 stations, and there's usually 2 questions at a station. It's timed, it's 90 seconds, and believe me, I started out, it was 2 minutes. That is so long that you're falling asleep. Even 90 seconds is a long time.
We're looking at pictures.
There'll be things out, but is going to be some microscopes that are out with slides on them. So these are slides now that you're going to be seeing this last lab that you have. And you're getting very, very close to the end. Thursday, when you come back from Thanksgiving, that will be your last lab. Last lab is going to have stain makeups. You're finishing up your clinical unknowns and handing that in. And let me tell you, let's talk about clinical unknowns. On that paper, where it's asking you to explain what the reaction is. The reaction isn't, it turned yellow. That's what you see, but what caused that? And in your lab book is a great book. It has tables in there. You can read about it. It's telling you what's going on. That's what you have to put there. So you should be, you know, working on it pretty well. Come up and ask me if you think, you know, and I'll tell you, nope, that ain't gonna do it. Because you don't want to lose points. You can get all those points if you put the effort in. If you don't, it's on you. I'm telling you. And I tried to write it out as much. Yes.
You could have finished talking. Sorry. Is our last lab on the 3rd or the 10th?
What day are you?
Thursday.
It will be on the Thursday after Thanksgiving. When is that? The 3rd?
The 3rd?
Yeah.
So that whole next week we're chilling?
Then the next week, after the last lab, is your lab practicum.
Oh.
The next week is your lab practicum.
So we're done by the 10th then?
From then, you have your lecture exam, I believe, on the 14th.
Oh.
But you're coming to the home stretch. So, and Karen's gonna have a lot of stuff out for you to look at, and some of that stuff's going to be on the lab practicum. And I will have a sheet for you to help you, what you're looking at, the last lab. And I will have a sheet to help you with studying for your lab practicum. And I gave you 2 sheets of your last test that you should be going over. And if it has an MVIC question set up in there, it isn't, oh, I'll study this one that says Citrobacter and don't study anything else. That's giving you an idea what's going to be on the test. So, let's see. Thursday has
The lab.
inoculated their InVix. Anybody on Thursday that has not done that yet? Everybody on Thursday's caught up now. Tuesday, you inoculated your media.
Yes.
So we're going to be looking at that media. You're gonna be bringing it up to me and we're gonna see that it's on the course of what you think you have. And then you're gonna get your InVic, and who takes a full InVic? Gram negative. So by the way, if there's a question on the lab practicum, please don't give me a gram positive. It's only for gram negatives, except for our clinical unknown. We know that which test are we gonna run if it's a gram positive? The VP. Who would be positive for a VP, positive VP?
Staph
Staph aureus and Bacillus subtilis. Micrococcus luteus will be what? Negative. We're looking for things between micrococcus and staphylococcus that would be opposite, you know, something that tells the difference between those two. Let's see, what else? Okay, for, and we're gonna, and I'm having you put everything in your drawer now because things disappear and I don't want that to be, you know, right? And,
I just
what
need
else?
to get an automatic A.
No,
No?
then we have to, analyze. We know how good at analyzers you are. I know. But some people aren't. Let's see, what else? I better call Rome. And for you nice little people that came, I'll give you a couple hints. So do you have any questions for me? Yeah.
Are we having a total of 5 lectures then? Or 4?
4, yeah. So
No,
already
for what part of the InVic that you're going to,
with the
you're going
last
to,
lab.
if, are you,
No.